on back pain, joint issues, everyday aches can affect people of all ages, but knowing when to seek help and how to treat those conditions can make all the difference in staying active and pain free. Dr. Dena Barsoum is a spine and sports medicine physiatrist at the Hospital for Special Surgery who specializes in helping patients to manage pain. We say good morning to Dr. Barsoum.
Good morning. How are you?
I wish I could say I had no pain, but I am arthritic. I have osteoarthritis, so I have pain all over my back. I've had neck fusion surgery there. So just I'm sharing with you. I'm sorry to do that. Like, I have a pain, doctor. Could you help me? I'm just sharing with you because I'm one of those guys who really should be in your office. I used to work with somebody when I was at ABC who told me that she had suffered for years with pain and an off gait until she went to a physiatrist and everything changed. So talk about what a physiatrist is, because I guarantee a lot of people don't know.
Great. So you and probably everyone else in your age group or as we age will develop osteoarthritis. A physiatrist is somebody who treats muscle, bone, joint, nerve dysfunction to allow people to improve their function and remain active in a non-surgical way. Physiatrists can treat people with disabilities such as spinal cord injury, traumatic brain injury, children with disabilities such as cerebral palsy. So there's a lot of different subspecialties within physiatry. I'm a musculoskeletal spine and interventional pain physiatrist. So I focus on, musculoskeletal issues, back pain, neck pain, hips, knees, shoulders, head to toe almost, to try to figure out what's causing a person pain or limitation to their function, use different non surgical tools to help them regain their function, resume the activities that they want to do, and then really improve their quality of life and prevention of injuries as we all age.
Gotcha. So an orthopedist treats the injury. A physiatrist tries to fix it so that you don't keep getting injured, right? So that if you have a gait that's off or you're having pain. So it's like saying, Doc, it hurts when I do this. You would say, don't do this. I'm trying to make it light, but basically you find what's causing the problems, right?
Yeah, so an orthopedic surgeon treats muscle, bone, joint, nerve issues with surgery. And at the Hospital for Special Surgery, of course, we have lots of very excellent orthopedic surgeons. But the truth of the matter is that many of the musculoskeletal injuries that we develop, many of the patients that call HSS for an appointment, don't actually need surgery. So seeing a non-surgical, muscle, bone, joint specialist can help you figure out, again, what's the diagnosis, what's the etiology of your pain or limitation to function, help figure out, if there are appropriate non-surgical treatments, and then sometimes surgery is necessary, and then refer you to the proper orthopedic surgeon. So very often a physiatrist can be the first line of evaluation and treatment, but often working in conjunction with a surgeon to get you the right care if surgery is what you need.
As my orthopedic surgeon had pointed out, he had asked me along the lines, are there days when you are not in pain? And I said, yes. That was 5 years ago. And then as I had days where, no, every single day the pain got worse, he said to me, when you get to the point where you keep waking up and saying, this sucks, that's when you need to come see me. Otherwise, but I'm kind of upset that I didn't get recommended to go to a physiatrist, because I think a lot of injury, to the body could be avoided by going to see someone like you who could tell people what they're doing. Sometimes it could be a gait problem, right? It could be a shoe problem. It could be all sorts of issues that could be throwing off the whole body. I used to wear bad sneakers that destroyed the way I was walking. And all I had to do was change the sneakers I was wearing and all the pain went away. Do you find that sometimes with patients?
Yeah, as the song goes, the hip bone is connected to the knee bone. So everything falls along a kinetic chain. And if there's an issue in one area, footwear, gait pattern, how your foot strikes the floor when you're walking, that can absolutely affect knee osteoarthritis, hip pain, back pain. If you have a little bit of scoliosis or impaired posture, that can affect your upper body, your shoulders, your head and neck, your lower body as well. So as a physiatrist, we try to look at the big picture, and help people determine, again, what's the limitation currently and how do we prevent issues in the future. I tell all my patients, I would love to make everybody 100% pain free. That's not very possible some of the time, especially as we deal with aging and the degenerative changes that happen with aging. So if we can't get to 100% pain free, I tell my patients I want to achieve three goals. I want to decrease their pain enough that they can do all the things that they want to do without pain limiting them. We want to make sure that you can sleep without pain significantly inhibiting that. And then also needing, making sure that you're not needing to take too much medicine to control the pain. So
Okay.
our
Well,
goal, as a
yeah,
physiatrist,
go
as a
ahead.
musculoskeletal doctor, is to keep people active.
Amen to that. I think people need to see if you have a chronic amount of pain, if you always feel your back hurting you when you get up, you shouldn't be waking up and getting out of bed in back pain. What's a website for more information, doctor?
So you can go to hss.edu and you'll find a wealth of information there about the different conditions that we can treat at HSS, the different specialties of doctors that we have here. But that's a great starting point to try to figure out, who do I see to feel better and remain active?
Hospital for Special Surgery, one of the greatest hospitals for treatment of joint pain and other things, but joint pain on the planet. And we're blessed to have it right here in the New York, New Jersey tri-state area. Dr. Dena Barsoum, Spine and Sports Medicine Physiatrist at the Hospital for Special Surgery. It was great to have you on. We have to have you back, please.
Thank you so much. It was a pleasure. Have a great day.
Thank you, doctor. You too.